Hello, and welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please call or text in your questions at 202-838-6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get the next show. And now I'm pleased to introduce Maura Quint from Families Over Billionaires to talk about tax day and your healthcare.
Hi, Laura. Thank you so much. It's great to be here.
So this week is tax day as people prepare and send off their taxes and pay their tax bills. Can you talk about what Congress is up to in regards to making a big tax cut for billionaires?
Yeah, absolutely. So tax day, I think most people don't look forward to it, but most people are willing to do their fair share and pay into the system. And unfortunately, billionaires and big corporations do no such thing. They have managed to reap tax cut after tax cut that has many billionaires paying very little, if anything, and major corporations paying nothing, next to nothing, some even receiving a refund, which is really, really appalling. And we're currently looking at a situation where the Republican-led House and Senate are trying to pass even more tax cuts for the wealthiest. So in 2017, when Trump first held office and they had a trifecta with all three houses, they passed a massive, massive tax cut. But that tax cut was set to expire within 10 years. And so it is up for expiration. And right now, the House and the Senate are looking to renew those tax cuts and, in fact, make them even worse, by which I mean give even more money away to the richest among us. So that's what they're currently in the process of trying to do.
And let's talk about this tax giveaway, because this is our money. This, as taxpayers, this is America's money, and we're choosing where to spend it. We could choose to spend it on expanding healthcare. Instead, we're choosing to give it to people like Elon Musk to buy more and bigger boats. So how is Congress planning on paying for these gigantic tax giveaways?
Yeah, it's really interesting because tax giveaways, of course, are not free. They cost huge amounts of money. And that's one of the things that Republicans have often said they care very much about. They care about not driving up the debt. They care about paying for things, so they claim. However, the tax cuts that have been passed under Republican presidencies have done exactly that. They've run up a massive amount of debt. And the fiscal hawks within the Republican Party are demanding that they pay for these big tax cuts. And the way that they are demanding that they pay for these tax cuts is to do huge, huge cuts in services. In fact, the House just passed their budget resolution last week, and it was a tricky, tricky vote. There were Republicans on the fence who weren't sure if they wanted to vote for it. They were worried that these cuts were not going to be paid for. And because of that, House Leader Johnson and, Speaker Thune and Johnson, those two, held a joint press conference trying to reassure the Republicans that don't worry, they promise they're going to do massive cuts. In fact, they committed to $1.5 trillion in cuts to services, specifically services that people rely on. And we have seen, regardless of the fact that they keep telling us, oh, we're not going to touch Medicaid. Well, the Congressional Budget Office said, actually, there's no way to do these cuts without cutting Medicaid. It is very clear you're going to have to cut Medicaid. They're going to cut Medicaid, they're going to cut SNAP, and they're going to cut quite a lot of other things as well, because $1.5 trillion is a very, very large amount. So fundamentally, they're looking to take away people's services in order to, let Elon Musk buy, I don't know, a 15th, 16th yacht. That's their goal.
And these numbers, trillions of dollars, is something that most of us do not understand, will not understand, because in our entire lives, we won't make $1 billion, let alone $1 trillion. So all these huge numbers are being tossed around that we can't even understand. Can you tell us what these cuts will actually look like? Because, maybe $1 trillion is hard to get your mind around, but what is that going to mean for the average American?
It's going to mean massive lifestyle changes. And when I say lifestyle changes, I mean direct harm to people's lives. When you talk about 1.5 trillion in cuts, you're talking about changing age requirements. You're talking about kicking people off of Medicaid. You're talking about kicking people off of food assistance and housing, rental assistance. You're talking about it affecting every single state, no matter what. This is what's going to happen. And once you start excluding people from Medicaid, you then have things like rural hospitals that rely on patients using Medicaid. When those people are no longer have access to Medicaid, those hospitals are going to shut down. So you're now going to have people who do not have immediate geographic availability of a hospital finding that they are now going to have to drive hours to get any sort of care at all. It's really going to have dizzying effects. And it is, I truly don't know how to say this other than it will kill people. There is no way around it.
And I think one thing that's especially frightening is that people may not even realize that these cuts are going to directly affect them, because Medicaid is known by different names in every state. So
Yes.
people may think, I'm not on Medicaid, but if you're on Badger Care, you are on Medicaid. And also, if your family member is in a nursing home or assisted living, that care may be paid for by Medicaid. If you have a family member that is disabled, that has supports so they can live at home, part-time or 24-hour caregivers, all of that is paid for by Medicaid. So this is going to affect people that can least afford the massive changes that will be coming their way.
Yeah, I think we often talk about this upward transfer of wealth, and it sounds very like heady. It's like an idea, right? Oh, there's wealth that was at the bottom of the population that's now being moved upwards, but it really does mean tremendous immediate impact in people's lives, because the people at the top do not notice when they get an extra 10, 20, 30,000 million dollars even. It has no effect on their life whatsoever. It changes nothing about the way that they live. But when you take away from people who are barely holding on, in effect, you are wrecking their entire lives. That is making it really nearly impossible to live. And those moments have huge, huge butterfly effects outward. So when you have someone who was receiving assistance who no longer is, who maybe now needs to pay for it, that has to come from somewhere else. So it also even then affects communities, right? So if somebody had a little bit of money that they now need to shift into their own personal care, if they had access to that, that means they no longer are able to hire a handyman. That means they are no longer able to hire childcare or other things that, again, are immediate effects to the community. So even people who maybe did not have any reliance on Medicaid would find that their life is going to be affected, because the individuals that were potentially bringing them business or had other, forms of any sort of means that they could spend are going to plummet, and the whole communities are going to suffer.
Mm-hmm. Yes, the tax breaks involved will not affect your community at all unless your name is Zuckerberg or Musk. But the cuts will affect every single person listening right now. If it doesn't affect you directly, it will affect your family, your neighbors, your communities. So what you said, this is an upward transfer of wealth. This is the rest of us having our care, our food, things that we rely on taken away to shower money on the people who least need it.
It's really shocking, isn't it? It's so straightforward and simple, and yet they are absolutely running ahead with this. This is 100% their plan. And what we keep hearing as well from Republicans, they continue to say things like, we're making promises that we will not cut Medicaid. These are empty, hollow promises. There's no way for them to continue ahead with this plan without doing exactly that.
Can you talk about the timeline? Because I am concerned some people may think that these cuts have already happened, and the Elon Musk Doge cuts, that's something else. We're talking about budgetary cuts. We're talking about cuts that would actually take place probably starting next year. But this process is not done. It's just begun, right?
It's not done. And it's actually really, I think, important for us to note, because Republicans, when they first started this plan, they thought they were going to just clip through this no problem. They thought they were going to run through their votes and their processes right in the beginning of the year. And instead, we have been able to really put a lot of wrenches into this. We've been able to draw this out significantly. So the House voted on their budget resolution last week. It passed by the narrowest of margins. It was a drawn out, difficult process. That's a vote that they were planning to have 2 months ago, but they just did not have the votes. They couldn't bring it to the floor. So it took them quite some time. And a lot of that is because they were hearing so much from people. They were hearing so much from their constituents. People have been angry and shouting about this, as well we all should. And that has mattered. It's made a real difference. So that had delayed the House budget vote. And now the House is going to move forward with the resolution. There's all these big, fun accounting deals, but the resolution is something that the House and Senate both need to agree upon. The House is going to start drafting it. We're expecting the week of April 28th. Their goal is to pass the House version of the reconciliation bill by Memorial Day recess, so that's May 22nd. And then we would expect the Senate to commence their work following that. So it would be sometime in early June that the Senate would be moving on this. So that's what we're looking at as a possible timeline. But all of this is still up in the air. And also, we are waiting to find out about the debt ceiling, which we need to know if the government is going to default. And that's going to potentially affect the timing of all of these things. They're waiting until after tax day to figure this out, because the question is how much revenue are they going to bring in, and they will not know that until after tax day. So that could throw some changes into all of these possible timelines. But we also could throw some changes into these timelines as well, just by making sure that making these senators and these House members scared, making them recognize that we see what they're doing and we don't accept it, and we are going to hold them accountable for their votes. That potentially could really push this vote off for some time. So we will see how that goes.
And I just want to emphasize again that this is the beginning and not the end of the fight. And if you go back to 2017, during the attempts to repeal the Affordable Care Act, the House passed their bill in early May, and the Senate, the vote that people remember with John McCain and his thumbs down, that was in July. And then they kicked around various other ideas through September and towards the end of the year, where they gave up on repealing the Affordable Care Act and just came up with the tax package, the tax cuts for billionaires. And so that was a whole year. And so right now, we haven't even gotten to the first part, which is that there is a bill and the House votes on it. So even if that happens, even if the House passes a bill, even that doesn't mean that this is done. Not until the House and the Senate pass the same bill.
That's right. That's exactly right. And what happened in 2017, I mean, as you certainly know, Laura, and probably a lot of people who'd be listening here know as well, is that people were so loud and organized and constantly vocal. That fight through the summer, the ACA fight, was really just such a testament to what can happen when people make a point to stand up and speak out. And I am still in awe of the work that was done to save the ACA, and so grateful for that as well, because that has saved many lives in very much the same vein that this could potentially harm so many people. That brought so many people safety and relief. And I think, we have the opportunity to do that again, but it is going to take a lot, as we know it did then as well. But I think from what I'm seeing, people are up for it. People are really, I've been so impressed with the sort of demonstrations and the consistent actions that people have been taking. It's really inspiring. So I'm hoping that we'll be able to change this tide as well.
And so to finish up, what can or should people do to stop raiding our healthcare for more tax giveaways to billionaires?
Yeah. I mean, we, like I said, have to be loud. So there are a lot of actions that have taken place. I would definitely recommend that everyone go to Mobilize, because it is a great space where a lot of different organizations will share things that are happening locally to them that they can participate in. Because there are many actions coming up. I know that there's going to be nationwide protests on April 19th. I know many groups are doing a May 1st action, and there's going to be kind of repeated, continuous actions happening. So for anyone who has the ability to join those, absolutely would suggest that. And of course, I mean, I know we're sick of it, but we're all doing it, right? We're calling our senators and calling our House members. And I think one of the important things as well is obviously that we do that, but that we also talk about it with people we know, because it's really a word of mouth campaign here, because Republicans have done a really good job of dominating the narrative that they want to put out there. And so we need to be telling each other, hey, this is what they're trying to do, and I need your help. And every time we can make those connections within our community, with our friends, with our family members, and bring them in and have them make some calls and have them speak out, that's where we're going to see the joint unified power that has the possibility of stopping this.
Thank you, Maura. And thanks everybody for listening. You are up to date on what's going on, but I think Maura's point is really important, that you can't assume that your friends and family and neighbors know what's going on, that the lack of good news sources and good news in general in our country right now means that people may not even know that this fight is happening and that they should do something. So please, not only contact your legislators, but also inform people what's at stake so they know about this fight. Thank you. And now we're going to answer some of the viewer questions with Louise Norris from healthinsurance.org and Rachel Madley from the Center for Health and Democracy. Starting with Rachel, let's go over what's happened in the past week or so on our healthcare.
Definitely. And thank you so much for having me. And I just wanted to give an update and reiterate what Maura was saying, that Republicans have passed their budget resolution, but there have been no cuts to Medicaid. So President Trump's priority tax bill that has the potential to cut Medicaid has not been passed yet. What the budget resolution that was passed does is it starts the process. It allows Republicans to start writing that bill, and it has some requirements, including requiring at least $880 billion to be cut from the House committee with jurisdiction over Medicaid. But Medicaid has not been cut yet. And I think the important part of that is there is still time to push back against these deadly cuts to Medicaid. And there's also still time to change what is in the final bill, if there is a final bill that is passed at all. And one thing that I think it's really important to highlight is that if there is this insistence on passing this bill that will cut taxes for billionaires, there is actually over $1 trillion that could be saved by stopping overpayments that go to big insurance companies overseeing the Medicare Advantage program. And that would not take away any care from patients. So there's alternatives to cutting Medicaid if there's this insistence on passing a tax cut bill. So Medicaid, under no circumstances, should be touched. And there are ways to stop that, including not passing this tax bill, but also including cutting down on insurance companies that have learned how to game the system.
Thanks, Rachel. And now a question from the speech prof on Threads, who says that I have a senior family member here in California with some serious medical issues. They literally have zero assets and zero income other than Social Security. And somehow they're being told that they are making too much money to qualify for Medi-Cal, which is California's version of Medicaid. And so they are having to spend much of their extremely limited budget on medical bills that basic Medicare doesn't cover. How do they not qualify? They have literally nothing. Louise, can you give us some insight?
Yeah, so this is a situation, it's what's called share of cost. And basically, it's a program. California is not the only state that has it. Lots of states have this, where if your income is a little too high to qualify for Medicaid, there's a system by which you pay your own medical bills until you get down to a certain level that they will allow you to then qualify for Medicaid. But unfortunately, it's very low in California. And just to clarify, the average Social Security check is almost $2,000 a month. That would put a single person over the limit in California. So if that's the only income you have and your Social Security check is about average, unfortunately, you would not, as a senior, qualify for Medi-Cal just straight up. You would have to go through this share of cost program. And unfortunately, the limit that they make you spend down to is very, very low. It hasn't been updated in decades. A few years ago, California did actually pass a budget bill that would have eliminated this program, the share of making people pay their own medical costs to spend down to this. Or maybe would have updated it, would have made it more livable. But then there was a budget deficit and they couldn't allocate the money for it. So this is definitely on lawmakers' radar in California, but it just hasn't happened yet. So reach out to your lawmakers, let them know how this is affecting your family member, that the limit that they have to spend down to is unlivable. But that's the explanation for why it's happening.
Thank you, Louise. And I would just like to emphasize, if you're in California, talk to your state lawmakers, because this is a state issue and not federal. So talk to your state senator and your state representative and your governor. Our next question is from Tamlin Joy, who says, what about signing up for Medicare if you're already disabled and turning 65? Rachel?
This is such an important question because many people find themselves in this situation. So the key thing here is when you turn 65, you keep your Medicare. There is no interruption to your coverage and you do not need to re-enroll. The one thing to remember is that turning 65 does open up a 7-month period starting 3 months before your 65th birthday when you can buy Medicare supplemental coverage, also called Medigap, if you don't already have it, or make changes to your coverage. So there is nothing that you need to do, but it opens up an enrollment period where you can make changes to your coverage if you feel like you want to do that.
Great. Thank you, Rachel. Our next question is from Sonia on Threads. A few weeks ago, I was bitten by a bat while sleeping. The next morning, I had a consult with a primary doc who confirmed it was a bat bite and sent me directly to the ER to start the rabies vaccine. The only place that has the anti-rabies vaccine on hand is the ER. I called my clinic and urgent care. They sent me to the ER. After my initial ER visit, I asked for the follow-up vaccines to be administered at my clinic to avoid more ER costs. The bill for this was $15,000. Louise, do you have any thoughts?
So, excellent that you went and got the rabies vaccine, because the alternative to that is death if you end up with rabies. So this is a really good example of a case where people really have no option. If there's a suspected bat bite, you have to go to the emergency room. That usually is, in most places, the only place that stocks post-exposure rabies vaccines. So the emergency room is where you're headed, and it is a multi-step treatment, and $15,000 is pretty average. Like, that is not at all unusual for the cost of doing this. Unlike other vaccines, like, for example, the MMR, the polio vaccine, flu shots, stuff like that is covered fully by health insurance. Rabies vaccine is not that way at all, because it's not a vaccine that's just routinely recommended for everybody. So regardless of whether you're going to be traveling to a country where you need to get the rabies vaccine ahead of time, or in this scenario where it's an urgent situation where you have to get post-exposure rabies vaccines, your health insurance will just make you pay your regular cost sharing, which means deductible and co-insurance all the way up to your maximum out of pocket. If you have health insurance, you will not be paying $15,000, because all real health insurance, assuming it's not something like a short-term plan, all real health insurance is capped at no more than $9,200 in out-of-pocket costs this year. So you're not going to be on the hook for the full $15,000, but depending on how your health insurance is structured, you could be on the hook for up to $9,200 in out-of-pocket costs for this. If you don't have health insurance, this is where it's really important to try to negotiate with the hospital and with the clinic that you used. There's a website, $for.org, that can help with that process. You can see if you can set up a payment plan, some sort of a sliding fee scale where they can waive part of the charges. So there are steps you can take if you have no health insurance and you're facing this bill. If you do have health insurance, you'll just need to wait and see what the out-of-pocket costs are once your plan processes the claim.
Thank you, Louise. Our next question or comment is from Gasaway E on Threads. Last year, I applied for Medicare weeks before my 65th birthday. Online, it said the typical time for approval was 4 weeks. After 5 weeks with no action, I called to ask what was happening. They told me I was scheduled to be approved in another 4 weeks. I had already canceled my Obamacare and was sick with RSV. Rachel, do you want to talk about what's happening here?
Definitely. So even if there is a delay in processing of your enrollment in Medicare, your Medicare effective date is when your coverage starts. That date is either the first of the month that you turn 65 if you applied for Medicare before you turned 65, or the first of the next month after you signed up. So even if your application has not been approved by that effective date, once it is approved, your coverage will be applied retroactively. So any medical care that you needed in between when your coverage actually started, your effective date, and when your application was approved will be covered. And if you did have to get medical care in that time, what you can do is contact the healthcare provider you received your care from. Once your application has been approved, provide them with your Medicare coverage information, and they will bill Medicare, and that care will be paid for. So even if you experience these delays, you are covered, and you will just have to then have your coverage applied retroactively.
And considering Medicare needs to approve your coverage, is there ever a reason why Medicare wouldn't approve if you are 65 years old and you have enough work credits? Is there ever a reason why Medicare would not approve your coverage?
To my knowledge, there is not. Sometimes there may be administrative errors that can slow down the process. And that is why I would recommend applying for your Medicare enrollment as early as you can, which is 3 months before the month in which you turn 65. So do it as early as possible, just in case some of those administrative errors do occur, so you have plenty of time. But if you do happen to apply, on your 65th birthday, and it takes a little while to become active and get approved, you will still have coverage. You just will have to provide the information to your healthcare provider, and they'll retroactively bill Medicare.
Thank you, Rachel. And thank you, everybody, for joining us today. Please text or call in your questions 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.